Hi, my name is Dr. Jannik Stemler. I am a physician at University Hospital of Cologne in Germany, and I'm working in the field of infectious diseases. And I'm also a clinical trial physician in the EU-COVAT-1 AGED study. And I'd like to welcome you to this video on the presentation of the study results of Part B of this study. So first of all, we'd like to do a brief overview on this study and what was it all about. So the EU-COVAT-1 AGED study is a clinical trial that has been carried out within the VACCELERATE consortium and the VACCELERATE network, which is a trans-European network of scientific institutions and universities to carry out and to boost clinical trials in the field of vaccinations and infectious diseases in general. And in this study, which was a sub-protocol of the VACCELERATE protocol, we randomized participants of advanced aged 75 years or older to receive one of the two available mRNA vaccines against SARS-CoV-2 as a booster vaccination. And it's important to distinguish between Part A and Part B of this study. Part A included a third vaccination, that means a first booster, and Part B, which we're talking about today, received a fourth vaccination, meaning that we're speaking about a second booster dose. The vaccines that were used are the BioNTech Pfizer mRNA vaccine and the Moderna mRNA vaccine. And this trial was planned and coordinated at the University Hospital of Cologne in Germany, where I am working. And I'd like to give you a understandable overview on the study results. First of all, we need to speak about the aims and objectives of a study, which are always previously defined before drafting a study protocol and recruiting participants of a study. So we aimed to evaluate the immune response against SARS-CoV-2 in elderly but already fully vaccinated participants, subjects older than 75 years, after a booster vaccination. So those were very important questions we were posing during the vaccine rollout in 2021, when the COVID-19 pandemic was at its height in Europe. And we were planning the study back then. And the primary objective was to evaluate the effect of the different mRNA vaccines as booster, and secondary objectives included, among others, the evaluation of the equivalence of those booster doses, and of course, as well, we evaluated the safety of those vaccines in elderly participants, which is always a very important objective when you test a medication or vaccine in a healthy population. Where was this study carried out? So the enrollment took place in 4 European countries, in Spain, Norway, Lithuania, and Germany. And 3 sites in Germany participated, and 4 sites in Spain, as you can see here, and 1 site each in Norway and Lithuania. And we are very grateful that we collaborated with these institutions and that all institutions enrolled participants for this trial to have a comprehensive population to evaluate our vaccines. There were also other institutions involved in the trial, for example, for the biobanking, for the laboratory analysis. We worked together with a lab in Antwerp and had the central lab there, and a lab in Dublin. We had the statistics department at the University of Vienna, and we're very grateful for our partners that we coordinate this trial together. What was exactly investigated? So we're speaking about endpoints, and those are the main points we try to evaluate in a clinical trial. And we defined as a primary, so the most important endpoint, the increase in antibody titer 14 days after booster vaccination compared to the antibody titer immediately before the vaccinations. And we're speaking about the antibodies against the so-called receptor binding domain of the SARS-CoV-2 virus. The secondary endpoint includes safety. As I already mentioned, we collected expected and unexpected adverse reactions immediately after the booster dose, but also on the long term. And that means any kind of potential side effect was collected and then attributed to the study vaccine or attributed to another cause, so not related to the study vaccine. And the immunogenicity was also an endpoint. So actually, those were laboratory analyses we performed to show seroneutralization of SARS-CoV-2 virus. That means that the antibodies produced that we're measuring 14 days after the vaccination are also capable to neutralize the virus in vitro in the lab. And we also evaluated long-term immunity, so 12 months after the booster dose within the trial. We took blood again and did the same analysis to show if there was a constant immune response or if there was a waning of immune response, but this data is not yet reported here. As you may recall at the beginning, I mentioned part A of this trial, and I just want to give you a brief recap, not to confuse you with part A and part B all the time. So part A was the first part of this study, which was carried out when the priming regimen, so the so-called baseline vaccinations against SARS-CoV-2 were considered as 2 doses, and then we evaluated the effect, the immunogenicity and safety of the 3rd dose, so a first booster within this part A. And then later at the beginning of 2022, the health policy makers and public health departments changed their vaccinations policies and recommendations so that a 4th dose, a 2nd booster, was then recommended for at-risk populations. And of course, elderly participants are among those at-risk populations. And in part A, we enrolled 53 subjects between November 2021 and January 2022 at a single trial site here in Cologne in Germany. 25 subjects received the Pfizer-BioNTech vaccine and 27 subjects received the Moderna vaccine as a 3rd dose, and 1 subject dropped out before study vaccine administration. And we saw that in this very small cohort, only 53 people, but we saw that both vaccines appear to be safe. We did not see any severe adverse reactions, only expectable adverse events in this cohort of older participants. And we had some indicators that higher antibody titers were seen and also higher neutralizing capacity with the Moderna vaccine. And those were the main results of part A of the study. So now we're jumping into part B. To understand well what we were doing, you briefly need to know what is the study structure. So participants were enrolled when they were 75 years old or older and had received a priming regimen consisting of one of these 6 combinations of anti-SARS-CoV-2 vaccinations. So here are included the Pfizer-BioNTech vaccine, the Moderna vaccine, and as you can see below, as a priming regimen, also the AstraZeneca vaccine. And then when the participants were enrolled, they received an on-study vaccine administration with either the Pfizer-BioNTech vaccine or the Moderna vaccine. And here we are speaking about the 2 study groups. This is a table on the demographic data of the participants. As you can see, we enrolled 270 subjects between February and September 2022 across the trial site I showed you before. 135 subjects received the Pfizer-BioNTech vaccine and 135 received the Moderna vaccine. And we want to show that the 2 cohorts are pretty comparable regarding their baseline characteristics. As you can see, the age, the median age is the same in both cohorts. The distribution between the genders is also pretty equal, and the priming vaccine regimens, this is already some detail, but just to show you that this is also very comparable, and that makes it a homogeneous cohort to perform such a trial. The primary endpoint, as you may recall, is the main result, and here we defined the 2-fold increase of anti-SARS-CoV-2 RBD antibodies 14 days after the study vaccinations. And as you can see here on the left is the Pfizer-BioNTech group, and on the right, the Moderna group. And as you can see, 78.3% in the Pfizer-BioNTech group reached this endpoint, so had a twofold increase of their antibodies, whereas in the Moderna group, even 87% of participants reached that endpoint. And as one of the exploratory endpoint, we of course measured the antibodies and then just calculated how many times those were increased, and there were 52% of the participants in the Pfizer-BioNTech group also reached a fourfold increase of their antibodies on day 14, and 63% in the Moderna group. Those are some subgroup analysis, which I will not be talking about in this moment, but for your overview, if you're interested in the proportion of subject who reach the primary endpoint differentiated by their priming regimen, you can have a look at this table too. And to make the full result of the primary endpoint a little more plastic, we give you this figure where you can see on the left side, this plot shows the baseline antibody titer on a logarithmic scale. In red is the Pfizer-BioNTech group, and in blue the Moderna group. And on the right side here and here, you see the plot with the antibody titer 14 days after the fourth booster dose, so the on-study vaccination. And as you can see, the median antibody titer, which is this line here in the middle, is way higher as the baseline antibody titer, and each line stands for a participant or for the increase of the antibodies of participants. And if the line goes like up to the right upper corner, that means that there was an increase in this participant's antibody titer. And of course, you see some lines that even go lower. As I showed you before, not all participants reached that primary endpoint, but most of them did, as you can see by most of those lines. Safety was very important, and every time we test a new medication, even if it's already licensed in this case, it needs to be evaluated in a clinical trial. And here we let the participants report their adverse events when they had received the study vaccinations. And the most frequently reported adverse events by the participants was expected pain at injection site for both vaccine groups, local and systemic reactions in the first week after vaccinations, where we systematically collected those adverse events in a diary. There were present fatigue as most common systemic reaction, which is also expectable after a vaccination. The most common local reaction I already mentioned was pain at injection site. Headache and hyperhidrosis were interestingly more frequently reported in the Moderna group. And there was even one severe adverse event. That means an adverse reaction or adverse effect that led to medical attendance or even admission to a hospital. And that occurred in the Moderna group, but this was only one that was attributed to the vaccination. This is an overview in this spider web graph. It's a little easier to understand than in a table. You have all adverse events here around this so-called spider web, and every circle around the center of this lab represent a percentage value. And as you can see, and as I already mentioned, among those general disorders like asthenia or fatigue, you see that those were more frequently present in the Moderna group, which is represented here in blue, but also pain at injection site was almost equal as frequent in both groups, as you can see here. Those are adverse events in the same kind of figure, a spiderweb figure, but referring to organ system classes. So, for example, headache or insomnia, or for example, skin disorders like rash or pruritus are represented here with the same kind of figure, but with another scale of percentages. but basically it's the same way. Blue is Moderna and red is the Pfizer-BioNTech group. And as you can see, there were slightly more adverse effects here in the Moderna group, as almost in all lines, Moderna has higher percentages, for example, for arthralgia, myalgia, nausea as well, and headache and insomnia, which I already mentioned before. But if you look at the absolute numbers, it's kind of tolerable. 17% of participants who received the Moderna vaccine reported headache. I think that is something that can happen after a vaccination, and if it's not too strong and needs medical attendance, something that can be tolerated. This was part of an exploratory analysis, but I think this is very interesting to the general population to see. Here we see the same kind of plots with the antibody titer increase before, differentiated by participants who had a SARS-CoV-2 infection prior to the on-study vaccination. And that means so in red, we see those participants of the trial who already had a SARS-CoV-2 infection before they entered the trial, and in blue, the ones who did not report a SARS-CoV-2 infection before. And on the left, this is the BioNTech group, and on the right, the Moderna group. They don't need to be differentiated really, but what I'd like to show you here is that the baseline antibody titers in those who already had a SARS-CoV-2 infection prior to study entry was higher in both groups, of course, and they even had a higher antibody titer increase. If you compare here this line with the line here, this is still higher, and here as well in the BioNTech group. So this underlines an hypothesis which you may have read about, where the so-called hybrid immunity, which consists of immunization via vaccination and via infection, leads to a better immunity in general against the virus. And this is something that can be derived from this figure as well. Those are also analyses which were among the exploratory endpoints, but this is also interesting. Here we see an assay on virus neutralization capacity of the antibodies of the participants. And this is at baseline, so before the fourth vaccination, before the second booster dose which we evaluated in the trial. And on the left side, this is the Pfizer-BioNTech group. On the right side, this is the Moderna group. And you see neutralization capacities against basically all relevant SARS-CoV-2 variants. On the right with gray, we start with the Wuhan wild-type virus, and then we go through all the variants, alpha, beta, blue is the Delta variant with some other strains, and in green, those are all Omicron variants as they emerged over time. This is the baseline value. So you see how well the antibodies the participants had before the study entry, after 3 vaccinations, then to actually neutralize the virus, to not only recognize the virus, but to neutralize it in vitro. And you see that the capacities are rather low actually before vaccination, because this is 25%, and maybe against wild type it's a little higher, or in the 40s, but against the Omicron variants it's like within the 1 digit. So this underlines that the Omicron variant had the ability to perform this immune escape, which we were reading about during the pandemic, and when the variants of concern came up, and then were also more frequently seen among the general population. This is basically due to their capacity to escape the human immune system and their antibodies to be neutralized by them. And then we measured we performed an analysis to show the virus neutralization capacity at day 14, so 14 days after the 4th booster dose within the study, and it looks like that. You can see that the virus neutralization capacity increased for almost all variants among the whole study group. And it was really high within the wild type. Of course, we may not see a SARS-CoV-2 wild type Wuhan variant infection anymore, but it's interesting that the antibodies built are that effective that they, in more than 90% of the vaccinated individuals, neutralize the virus that well. And we see within the Omicron variants in green that this capacity is still comparably low. And this, shows that the Omicron variant has some capacity and some characteristics that support their distribution still nowadays, and that infections still occur despite vaccination, which has been taking place 3 or 4 or even more times already. To summarize the trial results of Part B of the EU-COVAT-1 AGED study, I'd like to give you an overview here. So the 4th dose of either the Pfizer-BioNTech vaccine or the Moderna vaccine appeared safe in this sample of subjects of advanced age, 75 years or older, with regular rates of adverse events. We had some indicators for higher antibody titers within the Moderna group that received 100 micrograms of Moderna. And it's important to note that this is the double dose compared to the licensed dose within the European Union, but we didn't see any losses in safety for this doubled dose. And for the priming regimen, so if you still have an individual that has not yet been vaccinated against SARS-CoV-2, for the priming regimen, Moderna 100 micrograms was used, and only for the booster, this dose was decreased to 50 micrograms by the manufacturer. But in this trial, we used the 100 microgram dose with slightly better antibody titer increases. And we hypothesized that immunosenescence, that means the waning of the immune response over time, seems to play a role in an elderly population. And this is something we will see when we analyze the data 1 year after the on-study vaccination, where we will perform the same analysis I showed you before again over the whole cohort. And this is something that needs to be reported separately. I'd like to thank you very much for your attention. Thank you for watching, and thank you for listening, and have a look into the description of this video to find more details on Part A of this study and on the VACCELERATE network in general. Thank you very much. And thank you to all participants for participating in this very important clinical trial.